Welcome everyone, just waiting for people to join. I'll give 2 or 3 minutes for people to get in. People want to introduce themselves into the chat, you're welcome, don't feel you have to. Right. Welcome everyone. My name is Paul Harvey. I'm a co-director of the Basic Research Programme, which stands for, as you can see on the screen, Better Assistance in Crisis, which is an IDS Institute of Development Studies led research programme looking at social assistance in protracted crises. And we're here today to hear from Sophia and about the work she's been doing on financing social protection in protracted crises. And we have a great set of discussants who, after Sophia's presented the research, the paper of which came out a couple of days ago, the great discussants will discuss it. Sophia is an independent consultant who's been working at Basic Research on this piece of work. And our discussants are Wesam Qaid, the Deputy Managing Director of the Social Fund for Development in Yemen, who's also a member of the high-level panel on social protection in conflicts. Fardosa Abdullahi, who's the National Safety Net Programme Manager for Baxnaano and the Social Protection Policy Coordinator for the Federal Government of Somalia. Charis Reid, who's the Regional Social Protection and Humanitarian Development Peace Nexus person with ILO in the Arab region. And Ann-Kathrin Beck, who's the Senior Policy Officer on Social Protection at the German Federal Ministry for Economic Cooperation and Development, or BMZ. Sorry you're getting echo. I'm not sure I can do anything about that, but Pete so will do his best to see if there is anything we can do. And we've got a reasonably packed schedule for an hour. We'll try and make sure we have time for Q&A. I'll be mean on the presenters and discussants to try and get them to present quickly. And on that note, I'll hand straight over to you, Sophia. Oh, 2 bits of housekeeping. We are recording. It will go up on the IDS YouTube channel. It is a public meeting. Over to you, Sophia.
Great, thank you, Paul. And on top of the echo, I should apologise. I'm in my attic and it's just started raining very heavily, so I hope there's not too much background noise and you can all hear me well. So thank you, Paul, for that introduction, and thanks also to a few other people, some of whom I think might be on this call. So to Kirsty Laser, to Nick Rieger, and to Becky Carter, who were the co-researchers on this study. And I think there's a few other people on this call who provided input and insights along the way, and we really appreciated your support. So next slide, please. So I'm going to spend the next 15 minutes giving you a very quick run through the findings from the report before we hand over to our experts to discuss what it means for their work. Next slide. We're going to start with the context. Next slide. So in short, this study comes out of the understanding that delivering on global social protection promises has to involve focusing on people living in crisis-affected contexts. So we know that more and more of the world's population and more of those living in extreme poverty are living in places of extreme levels of fragility. And we also know full well that progress on SDG 1, for example, has either stagnated or it's gone backwards in almost all highly or extremely fragile fragile contexts. So we're simply not going to manage to meet global commitments to increase social protection coverage without a concerted focus on crisis-affected contexts. And this chart gives an idea of the scale of the challenge. It looks at poverty rather than, or income groups rather than levels of fragility, but there's some crossover. It shows the ILO estimates of the financing gaps in the lowest income countries, so that column on the left. We can see that gap there. And we also know that social protection coverage tends to be what someone has called topsy-turvy. So 80% of people in high-income countries are covered by at least one benefit, but just 10% in low-income countries. And we also know, of course, that supporting social protection coverage in places where poverty and crises overlap isn't easy, and hence our study. Next slide, please. Which, before we get into the findings, I'd just like to very quickly clarify what we're focusing on and what we weren't focusing on in this study. So you'll hear me talking quite a lot about protracted crisis contexts. So our study focused on a group of countries which were experiencing protracted crises. In other words, countries which had experienced humanitarian crises signified by an international humanitarian appeal for at least 5 consecutive years. And there's quite a bit of overlap with these countries and extreme fragility and low incomes, but they're not exactly the same. And we focused on protracted crisis contexts because they present a clear set of challenges and issues. So firstly, the obviously protracted crisis in the shape of conflict, climate and polycrises, they escalate the need for social protection whilst they also corrode the fiscal space to provide it. And secondly, that these contexts provide some real litmus tests to making social protection work. So tests around, does it work in political and economic volatility? Does it work where you've got populations on the move? Does it work in connection to humanitarian response? Now, of course, looking at a big group of countries like this is always going to be a bit broad, a bit generalizing, and our group of 27 protracted crisis countries included situations as different as Ukraine, as Somalia and Yemen, as we'll hear from our discussants, and we were very conscious of the distinctiveness in each context. A few words on the other focus of this study, which was on official development finance, which you'll hear me shorten to ODF to keep to time in this webinar. And this focus on aid, on international aid, might seem a bit perverse amidst all the current discussions that are going on at the moment in what some have termed a sort of post-aid world. But we know, of course, that international aid is only part of the financing puzzle, and domestic ownership and financing are really key for social protection. Yet we also know that in many crisis contexts, international support and understanding how best to challenge it are of major importance. And at this critical juncture where the international development and humanitarian financing system has somewhat been turned on its axis and forced into a radical reckoning by all the dramatic cuts recently, examining the place of ODF for social protection is arguably more relevant than ever. This brings us to the next slide. So for those of you that managed to make it to the end of the report and read it right to the end, you'll have seen that we took the unusual step of including an epilogue. Why do we do this? Well, because due to data availability, our financial analysis focused on the period 2018 to 2023, and we also undertook most of the research in the second half of last year, 2024, and we'd pretty much wrapped it up, most of the big research, by January. And then, of course, the US aid freeze happened, followed swiftly by cuts from the UK, which compounded previous cuts from other donors. So I'm not going to go into all the shockwaves from this, all the resets and the rethinks and the restructures that are going on. That's a whole other webinar. But suffice to say that 6 months on, we'd hope to be in a position to draw some conclusions about what this means for our findings and for financing for social protection, and to be able to expand the thinking that we started in the epilogue. But as you all know, there's still extended uncertainty around international development and humanitarian aid, and we're hoping to be able to put out a blog on this next week, and we'll continue to monitor the situation over the rest of this year. So, epilogue, first and out the way, let's move to the actual financing trends that we found. Next slide, please. And then the next one. So my co-researchers, Kirsty and Nick, analysed the financial data on how much ODF went to supporting social protection in this group of protracted crises over our study period, and they compared it to other contexts. Now, if we factor out the noise that you see in the middle of this graph, which is around COVID, that COVID-related spike, and we just compare pre-COVID, so 2018, with post-COVID years, so 2023, we'll see, as you see in this chart, a significant increase in both the share of social protection ODF that was directed to protracted crises countries and the total volume. So you can see the difference between the bar on the far left and the bar on the far right. So we saw that ODF for social protection globally more than doubled from 2018 to 2023, but then we also saw that the amount directed to protracted crisis countries more than quadrupled. So it reached about 4.78 billion in 2023. So this looks like good news, it looks like progress. But then when you start to unpick it and you look a little more closely, we saw that the rise was primarily driven by large allocations to Ukraine and to Turkey, which at the same time masked significant drops elsewhere in Niger, in Somalia, and in Lebanon. Next slide. We saw that the default mode, and we know that the default mode in protracted crises is humanitarian assistance rather than development. And we also know that emergency aid was the largest aid sector in protracted crisis countries. It accounted for about a total of 24% of ODF in protracted crisis countries, compared to the 3% that was allocated to social protection. So this relationship between humanitarian assistance, humanitarian financing, particularly that goes towards cash and voucher assistance, is particularly complicated and crucial when it comes to social protection finance. We try to estimate the levels of humanitarian cash and voucher assistance in protracted crisis countries. It was tricky. There's issues around data availability, which means that we can only get a partial picture. But from this partial picture, we can perhaps see hints of a trend, because what you can see with these two bars, the darker bar being humanitarian cash and the lighter bar being social protection, was that humanitarian cash had previously tended to exceed social protection investments, but for the first time in 2023 they appeared to draw even. Now I've got to repeat though that the cash bar that you're seeing here is only part of it, and the final figures are likely to be much higher. And the picture also varies massively between countries, and if you take away anything from this webinar, it's this country variation. But again, insofar as we can draw patterns, it seems that development money for social protection follows social protection systems. So those countries with so-called engaged relationships with bilateral donor governments, and those with established social protection systems tended to receive more social protection ODF. Next slide. If we look at where the largest volumes of social protection financing to protracted crises countries came from, we see a picture of quite extreme concentration. Now this chart's a little bit difficult to read, but in that very difficulty there's a message, because if we focus on those two blue strata at the bottom, the message is quite clear. We see that nearly 3/4, so 73% of social protection ODF for protracted crisis countries came from the World Bank over the 5-year period. So the darker blue at the bottom is IDA and the lighter blue is IBRD loans. And you'll also notice that the spike in 2023 is largely due to a spike in loans from IBRD, so primarily to Ukraine in 2023. So all this to say that 73% means that what the World Bank does in protracted crisis countries matters enormously. And although some of the financing fears that were circulating earlier this year have somewhat been assuaged, we know that the US has retained 3.2 billion out of its 4 billion IDA pledge, there are still questions about the future direction of the bank on social protection and on fragility. What about the other government donors, the ones that take up those relatively smaller slivers at the top of this chart? Well, we know that although they provided significantly smaller amounts, the quality of that financing, and I'll come back to this later, and the nature of engagement have tended to be critical. So the fact that 4 of the largest bilateral donors of social protection, other than the US, so including the UK, Germany, and Sweden, they all had cuts on the table is significant, as is the protracted uncertainty about what this means for social protection. Next slide, please. So apart from the volumes of social protection, the quality of international support for social protection really matters. So the duration, the predictability, the flexibility of the terms of financing can be just as important as its quality. And if we move to the next slide, we'll look at one aspect of this. And one dimension of this is the concessionality of financing, whether it's in the form of grants or of loans. So it's kind of obvious, it's self-evident that if you land more debt on countries which are experiencing the economic strain of protracted crises, a strain which is often layered on top of already low incomes and other financial shocks, if you land that debt on those countries, it's going to be a counterproductive way of financing sustainable social protection systems. And indeed, one source showed us that low-income countries spent twice as much on interest on debt repayments than they did on social protection. So it stands to reason that we found that grants were a much more important modality in protracted crises than in other contexts. So protracted crises received nearly half, 46% of the social protection ODF in the form of grants. That's the red bit of the bar over the period, compared to 16% in other countries. But we also noticed that while lower interest or concessional, they're called concessional ODA loans for social protection, that's the black bit of the bar, had slightly decreased, the higher interest lending, which is known as other official flows or OOFs, that's the green bit on the bar, had more than doubled. Again, that takes us back to those high value IBRD loans to Ukraine. And this brings us back to why the aid cuts from bilateral donors really matter. Because those donors were much more likely to provide grant funding than multilateral development banks were. So bilateral donors and the EU provided 87% of their social protection financing to protracted crises countries in the form of ODA grants. So although the World Bank is the more significant donor in terms of size, the grant orientation of bilateral donors has an important complementary role to play in the financing landscape. So if we look ahead, we've got to have a judicious use of loans and credits in eligible countries, but it has to go hand in hand with debt relief initiatives to free up domestic revenue. And there's opportunity in the upheavals in international aid to refocus on this. And although we see that debt relief decisions have tended to be taken in a different political sphere to decisions on social protection expenditure, there's a clear case for bringing these conversations together. Next slide. So clearly, international financing should, by default, be, in an ideal world, be directed to state-owned systems. But of course, the thing about protracted crisis countries, or many of them, is that they pose active challenges to that way of working. Many are characterized by complexity, political complexity and volatility, with difficult relationships between donors and the state. And in fact, we found that 7 out of our group of 27 protracted crises countries had had support to the government suspended by the World Bank at some point in the study period under what's called Operation 7.3, that provision that kicks in when there's unconstitutional changes in government. Now, nonetheless, despite this, we see that the vast majority, so 83% of ODF to protracted crises countries, is still reported as going via governments. And that's largely because of the World Bank, because government channels are the default for World Bank financing. Now, there's lots of variations and reporting quirks hidden behind this simple pie chart, but it does suggest 2 things. Firstly, that donors are committed to supporting national systems, but on the flip side, that there's a lack of a general lack of financing in the places that they can't commit to doing so. So finding agile ways to switch financing flows amidst political estrangement or volatility is absolutely imperative to maintaining social protection systems and transfers. And we know that there are established models, many of you are very familiar with them, for switching or pivoting financing modalities. But again, in our research, we also found multiple examples where those pivots were slow or they were clumsy and they left gaps in crucial support. So we concluded, and building on the work of others, that if you build this flexibility, these switches into support from the very outset, so you pre-agree these contingency plans that work in volatile polycrises, that can help to avoid this. So, final substantive slide. So we saw before that international financing for social protection is characterized by a few big World Bank transactions to a few countries. So on the one hand, it's highly concentrated, but on the other hand, there's a very long tail of very small transactions. And to get an idea of that long tail, we counted up how many combinations of donors to partners there were over the period. And we found nearly 1,200 of these, and tellingly, they tended to be for very small amounts. So 3/4 were for less than $1 million. And if you put that in perspective, it's a much higher degree of fragmentation than we see for humanitarian aid in these countries. Now, of course, there's some resilience in a diversified financing ecosystem, and we'd want to see that as part of a drive towards localization. But there's also a price to pay in terms of coherence and cost effectiveness. And here's a couple of quotes from the Sahel Adaptive Social Protection Programme and from the Ukraine response, which illustrates some of those. So it's familiar coordination question, coordination between donors, implementers, humanitarian cash and social protection, but ultimately one which asks what would happen if all these investments worked at the very least in well-informed complementarity. There's various ideas on the table around this, but ultimately what's needed is strong national social protection financing plans backed by transparent, timely information. And it seems that at this time of major aid cuts, ODF can go one of two ways, can't it? Either greater fragmentation as recipients compete for smaller pots of money, or greater coherence in a concerted effort to make the best of use of scarce resources. So just to conclude, although we've focused in on the detail and shown you lots of charts here, it's clear that we're about ODF. It's clear that financing for social protection can't be treated in isolation, that yes, it demands specialist financial flows and a specialist technical approach, but it has to be deeply embedded in wider conversations about aid reform, about debt, about risk. And it's really good to see some of these wider conversations starting to happen. So I'd like to hand back to Paul to introduce our discussants who are actively engaged in these live discussions, both at a global level and in the nuts and bolts of making this work at a country level, because ultimately what matters in social protection financing is what works and what doesn't in that space that connects international support and national provision of social protection. So if we can just put the final slide up, and I'll thank you for listening to me. And there's the link to the full paper. And if you've got any questions, you can reach me on this email address. So back to you, Paul.
Thanks, that was brilliant, Sophia. And obviously do read the paper, which is up on the IDS Basic website, and Tabs will put a link to it in the chat. If you have questions or comments, start putting them in the chat or the Q&A. We'll do our best to respond to them. But we're going to hand straight over to the discussants. One of the discussants we hope to have was Wesam Qaid, who's the Deputy Managing Director of the Social Fund for Development in Yemen. He's probably not able to join us. I can't see him due to internet challenges, partly because it's Eid, and so the IT wizards at SFD are taking a well-deserved Eid break, and so we haven't been able to sort it out. But we did get him to pre-record something. So we're at this stage going to hand over to Tabs. He's going to put up a pre-recording of Wesam talking about his sort of reactions to the report and what they mean in Yemen. tabs over to you to hopefully put Wesam up on the screen. Talk to me, tabs. Are you succeeding? Yep. Okay, great.
Good afternoon, and thank you for inviting me on the webinar today. I think the report is excellent. It's one of those that you keep going back to. I can imagine this is going to be referenced a lot. My first reflection is, if you find a path with no obstacles, it probably doesn't lead to anywhere. You mentioned in the report a quadrupling of social protection financing from 900 million to 4.8 billion, and that truly is a great step. But my suspicion is that much of this is concentrated in countries like Ukraine, Ethiopia, and Yemen, where social protection systems already exist. And I think there's a double-edged sword of existing systems. Concentration tends to indicate that donors and implementers prefer to work where some institutional capacity, even if it's weak, already exists. And this makes sense from the point of view of efficiency and risk management. But it's easier to strengthen or expand something than to build something from scratch. So we're choosing the easy route. The flip side is exclusion of the most vulnerable. The most difficult countries are going to be left behind. And these are precisely the places where vulnerability is highest and where people are most in need of that regular, predictable support. And without it, we're exacerbating the humanitarian caseload and we're undermining foundational resilience. So we need to take greater risks ourselves in traveling the more difficult paths. My second point, a key partner in charting these difficult roads is going to be the World Bank. As the report rightly lays out, the World Bank is a significant contributor with around 2/3 of the funding. The problem here is that the World Bank's operating procedure, 7.30, which was developed during the Dayton Accords back in the 1990s, so that's 30 years ago. This procedure puts limits on what the bank can actually do in such countries. For example, in Yemen, where I come from, the World Bank technical teams overseeing around 1.6 billion in IDA support to social protection have not been able to visit the country since 2014. They only work through third-party implementers, which results in inefficiencies, and it comes at the expense of localization. And I think after like 30 years of 7.30, we really should be looking at how we carve out caveats for emergency and providing vital basic services. So the continued funding and implementation of social protection delivery programs can remain with the relevant safeguards in place. And I think it's just not acceptable today to say that the safeguard is 730, operating procedure 730. We need to do more to fix that. On a positive note, the World Bank is now processing its review of its current strategy for conflict affected states, and I hope there will be an examination of operating procedure 730. However, to get to something meaningful, those supporting IDA, the countries supporting IDA, will need to ask for its review. My last reflection is on the epilogue at the end of the report, which basically asks the question, what's next for the vulnerable after the lifeline is cut? Last year, OCHA called for $50 billion US. They got 24 billion, half of which came from the United States of America. What will 26 look like? What will 2027 look like? Is there a silver lining in all of this? I think so. I think I see it is embracing localization amidst these grim realities. Instead of cutting a lifeline, we have the opportunity to cut delivery chains, fostering more direct and resilient support that enhances capacities. So the three big questions I have from reading the report is, how do we keep the taps running while treading difficult paths in a manner that builds local capacity? Not easy questions to answer, but to end on a positive note, the UK and the Somali governments have launched a high-level panel to support a public inquiry that seeks to answer some of these questions towards scaling up social protection in hard places. So I encourage all to engage with the inquiry, and definitely this report too. Thank you.
Brilliant. Wish we could thank him in person. Fantastic as ever, Wesam. And the operational policy 7.30 is talking about the bank policy that applies in cases of de facto governments, where the bank can't directly contract with governments in the countries in which operational policy 7.30 is put into place. So it applies to some of the places we're talking about, but not all of them. It applies in Yemen and Sudan, but not in Somalia, for instance. And I think Tabs has put a link to the actual policy in the chat if anyone's interested. Right. Charis, over to you. Charis is regional social protection person for the Arab region for ILO. And without more ado, over to you.
Yeah, thanks. And first, just to say thank you for the excellent and I think much needed piece of research. So I think just to highlight up front that I know it's a double-edged sword, but at least this report shows that social protection financing is possible in protracted crises and that donors prioritize national financing systems. I think that narrative is not always evident in country, even in countries that are receiving this financing. So it's great to see it documented. In my intervention, I want to primarily reflect on the use of domestic financing for social protection. So the report recommends at the end national financing plans for social protection. And here, I think the key word is national. So based on each country context, we need to examine and prioritize what options there are for domestic financing. This is the only way to ensure sustainable protection in the long term, and particularly in the context of the current aid cuts and uncertainty. So in general, not in protracted crises, there are multiple ways in which the space for domestic financing for social protection can be increased. The ILO usually works through its fiscal space handbook for social protection, and a second edition of this is due to come out soon. But basically this outlines 6 options for increasing domestic financing. So number 1, expanding social security coverage and contributory revenues. Number 2, increasing tax revenues, eliminating illicit financial flows, reallocating public expenditures, borrowing and restructuring existing debt, and increasing aid and transfers, but with a view to extending national capacities for domestic resource mobilization. So these tools exist, the ILO has these tools, but the question is, how relevant are they for protracted crises, and how can we apply them more if we're not doing so already? So I just want to focus on contributory social protection with a couple of examples from the Arab states region. And I think often in these forums or webinars, we talk about social protection from the lens of social assistance, but actually contributory revenues can provide a more sustainable and reliable option to ensure coverage of social protection in the long term. And this is the case for life cycle risks, but it's also the case for acute shocks and in protracted crises. Just as an example, that during COVID, thousands of existing social insurance schemes, so things like sickness benefits, health insurance, unemployment insurance, continued to perform as they were intended to do. So maybe they were underreported, but they provided income security to people affected by the crisis. And I think we need to be aiming for something similar in protracted crises. So for instance, in Syria right now, and also in Palestine and other countries in the Arab states region, despite the changing turbulent context, the contributory social protection systems have continued to make payments and remained functioning. They have limited coverage and they need to be strengthened, but we should be looking to extend these mechanisms that have already continued despite everything. And in Syria, the legal coverage of contributory social protection is actually relatively high, but what's missing is effective coverage. So only 1.6 million Syrians in the country are active members enrolled in the National Social Security Institute. So we need to look at how to extend this, and therefore contributory revenues. And we can look at doing this by enrolling more of the labour force into the social security system. So just to give the example, the case in Syria is complex, obviously. There are many returnees, forcibly displaced persons, and there's also a large informal workforce in the local population as well. So we're planning to do a study to see which branches of social insurance these workers might be most willing to contribute towards, and then we'll look at how to strengthen it. And we have actually done something similar in Jordan as well. So finally, the other point I wanted to mention is the need to support statutory schemes. So the ILO monitors social protection expenditure through its social security inquiry, but this focuses specifically on statutory schemes. So there's a need to invest in schemes that are embedded in a legal framework, and these are proven to be more sustainable in the long term. So all of that being said, just to say in summary that obviously there's a need for ODF to continue supporting social protection in protracted crises. It's needed if we ever want to transition away from humanitarian crises, and also this report shows that it is possible. We just need to work out how. But within that ODF, it also matters on where the support is channeled. So interventions should be prioritised that increase domestic financing or support statutory schemes, even if this comes at the expense of kind of quick wins that donors might want to see. And then just from my side as the ILO and as custodian of the SDG target on universal social protection, then we should be trying to better adapt our tools that we have at the global level to be relevant in these protracted crises contexts. Thank you. Thanks.
Brilliant. Thank you, Charis. And we'll look out for the work on Syria you're mentioning. Also look out for forthcoming basic research by Rachel Slater and colleagues at Proximity on Syria. It's been looking at some of the similar issues around how systems have been sustained or not through the period of conflict, and what might be done to support them as conflict shifts. Right. Again, without too much further ado, we will hand over to Fardosa, who we're delighted to have. Somalia trumping Yemen in terms of its internet connectivity, we hope, and so we're actually able to have Fardosa in person. Fardosa, as I said, is the National Safety Net Programme Manager for Baxnaano and the Social Protection Policy Coordinator for the Federal Government of Somalia. So assuming you're with us and connected okay, Fardosa, over to you.
Thank you so much, Paul. Thank you, Sophia and IDS for having me. Just a disclaimer, I'm not in Somalia, so just in case my internet doesn't behave, just that you know, it's not a Somalia issue. No, thank you so much. And the connectivity is quite good where I am. I'm actually in Nairobi at the moment, and very happy to see social protection in the center of the global discussions, especially in fragile countries. From last year, and a couple of other organizations also talking about social protection, and really the need of social protection being in the highest agenda of the highest political offices in both the fragile countries as well as the donor giving countries such as the UK. So thank you so much. I'm just going to perhaps touch a little bit on where we are in terms of the financing for social protection in Somalia. So just on where we are, perhaps I'll speak a little bit on the paper that is just the research that's just coming out from the Institute for Development Studies. But I'm just going to go directly onto the interventions that Somalia has, the biggest interventions on a national social protection Baxnaano program. Recently, what we have launched is the second phase of Baxnaano, which looks not only on safety nets, but also looks on economic inclusion as well as co-responsibility cash transfers for education and health. So today's discussion is more on the financing, and our financiers on the Baxnaano program is the World Bank, and I'm happy to really say that they have financed it for the last 5 years, and I'm hoping that we will have a secure funding for the next 4 years. But the question is, can we work on social protection and on project-based cycles or can we also rely on one donor to ensure that, you know, the most vulnerable of a country is catered for? The answer to that question is, I would say no. And I think discussing or looking at sustainable ways of ensuring that social protection is fully financed, especially in fragile countries, I think it's something that global discussions is now ongoing. Very happy to say that at the moment, we are able to reach out to the bottom 10% of Somalia's population. And not in all districts, but in 21 districts, which leaves up to about almost 60 other districts without social protection. And we are also reaching to really the vulnerable, the poor of the poorest, which we are also leaving the ones who are just above the 10% threshold to also be, you know, have the risk of falling into the poverty line. So my, you know, contribution to this, I think, and we have had, Wesam have mentioned the high level inquiry that is ongoing with Staff Facility and FCDO that Somalia is also co-chairing, is also to look at the social protection in fragile countries. And I'm really happy to see that Somalia is co-chairing that. So looking at, you know, more sustainable ways and more innovative ways of ensuring that financing of social protection is not only relied on one donor, and especially when the donor is a multilateral donor, and the governments also have like certain envelope, and, you know, also looking at other priorities that they might have, looking at budget support that they you know, paying for the teachers, paying for the militaries, paying for roads, the education and health. So social protection becomes really unimportant in such settings. I think what we need to really look at is how do we increase domestic revenues? How do we actually even with the fragile countries, the natural resources that they have, how can that also be linked into financing social protection? I was in part of the high-level panel in the UK, and I don't remember her name, mentioned that most of the fragile countries in the world now is Muslim countries, or countries that also pay zakat. So how can we also leverage the zakat, which is about 2.5% of the population's wealth, which is really quite high if you see in other contexts? How can we also leverage zakat? How can we ensure that social protection financing is not only relied on one sources and not another? So I will stop here. And I'm very happy to say that we are on the right trajectory in Somalia in terms of ensuring that we look at social protection as a whole package and not only on safety net, but we also work on ensuring that whenever shock happens, we will be able to systematically respond to the shocks. Great,
thank you, Fardosa. Right, we're running short on time. We want to try and have time for questions. Ann-Kathrin, it's always the danger of being last is you have your time squeezed, or maybe it's an advantage. But anyway, over to Ann-Kathrin, who is the Senior Policy Officer at BMZ at the German government on social protection, for some quick reflections, and then we'll open it up for some couple of questions.
Thanks so much, Paul. I don't only have the challenge to like squeeze it all in from the donor perspective, but to also not only react to the study you have just published, but also to a little bit to what my previous panelists have already mentioned. And it is really interesting to follow this discussion, because generally when we hear about financing, we really think about how much, right? But we should really change this narrative and not only see it in this like mono-dimensional way, because it's not only about how much is going into the system, it's also how much is coming out of it. What are we really trying to achieve? How can we have that quality narrative? So from the donor perspective, I want to dig a little deeper and look at the who is involved, how are we doing things, what are we doing, and what are we really achieving with this. So I'm speaking on behalf of the German government, but also of many other actors, where actually we do see that there is a separation between humanitarian and development finance. And these are silos that are really hard to break. You're referring to it as like intra-donor coherence. How are we making sure that we can work more aligned within our own governments? In Germany, you probably have read it, there's a German Federal Foreign Office who does humanitarian assistance, but there's also the BMZ, which does development work. And in order to work along the HDP nexus and really integrate humanitarian and development, we need to work together better. And I say this both on the global level, but then also on in-country coordination. So on the global level, we do have a series of, or we do have regular exchange, which is called joint analysis and aligned planning, where we do look at PCC countries specifically to understand what everyone is doing and how can we work together better. Because it's not only about having a general understanding of the nexus, but also about operationalizing these approaches and doing that in practice. This brings me to the how, because in the context of Germany, we do actually have instruments such as the transitional development assistance, which has been quoted in the report as well, where we really do have an instrument that is humanitarian in its first response, but feeds into that structural approach, that feeds into systems building. And we can have this instrument because we do make the active effort to align between our humanitarian and our development work. We're also doing that with something called the Nexus Chapeau approach, where we do have an integrated look. So this allows us to do that intra-donor coherence approach, but then we're also looking at coordinating with other donors across the board. You have already mentioned the high-level panel that Germany is also part of, these like high-level global agreements, but we also align with multi-donor trust funds. We try to channel our money in like bigger pots so that the effects can be potentiated. And we don't only look at this from the global level, but also on the local level. So we do have really strong in-country collaboration where Germany makes all the German actors talk together, but also aligns with other donors on the local level. And further also tries to bring United Nations, big NGOs, the multilateral development banks together. And all that being said, this is an active effort, really. There's nothing automatic. You need to work through it. Sometimes it really depends on whom you're talking to on a local level, if things are working, if coordination is happening. Lastly, of course, national priorities remain paramount. And I think that's a little bit the caveat, both for donors, but then also for countries in protected crises. Fardosa just spoke to that there are like multiple requests going to governments about what all they should be supporting and funding, so they're hard decisions to make. And especially in this challenging context where we're like seeing decreasing ODA levels, this also does apply to donor countries where we really need to fight hard and make good narratives and really show the effects and the impacts we can have when working through social protection. So lastly, a little bit to the what are we doing? What can a donor like Germany support? So as I already mentioned, we're employing an HDP Nexus approach, and we have several tools for that. We had a big political focus on the Sahel over the past years, which is really a prime example of having countries that are in protected crisis situations, but where situations can also change, and we really need flexible approaches. So in the report, you already mentioned the joint program. That is financed through German TDA, and that employs a true track approach, where we really employ what is like very crucial for Germany to have a system strengthening approach and to have this in mind, even for protected crisis settings, that we try to work through government systems wherever we can, and that we have a fallback option to work through non-state systems whenever we need it. But then also in doing so, we try to use government systems, social registries, delivery mechanisms as much as possible. This has allowed Germany to follow one of our main principles, which is to remain engaged, because we know that in different countries where we have crisis situations, it is really hard to work with governments. But then we should use all tools, diplomatic as well as development ones, to remain engaged and to really continue working for the people who need these social protection services. Yeah, and in doing so, we are trying to work along the comparative advantage of different actors involved. I leave it to that example because I know there may be questions on the floor. But I want to leave you with one last message of like, what now? Like, what are we taking out of this? How can we continue working in these settings? And from a German perspective, really believe that we have to continue the integrated planning, that we need to invest smarter because resources are limited and they will not be getting a lot more in the years to come, and that we continue to focus on systems building, even if it's costly, even if it means we sometimes have to take hard decisions, but it certainly is the scenario that sets us up for more domestic ownership and more domestic financing in the mid to long term.
Great, thank you, Ann-Kathrin. So we have 10 minutes left, so we can sort of take 2 or 3 questions. We have one excellent question or sort of point from Moa in the Q&A, talking about what we've also heard from the panelists about how social protection investments are competing with other essential services and other essential investments, both for financing and for the sort of political attention of domestic and donor governments. And so he's asking, he or she, about scope for sort of social protection to be aligned with other foundational services. So if any of the panelists want to pick up on that, but before they do that, does anyone else want to come in and ask a question on screen or type something else in the chat? We'll give anyone who wants moments to type. Failing that, does anyone want to come in on Marwa's point in the Q&A? And Ryder, yeah, I don't know whether you can come on screen. I've just realised. So Ryder, if you can come on screen, do. If tabs tell us if they can't, and in which case, Ryder, you'll need to just type it. With apologies, my not having checked this beforehand. Ryder, okay. Type a short version. While you're typing a short version or typing a long one, any of the panelists want to come in on Marwa's point? You go, Charis.
Yeah, thanks. Just to briefly say, so I mean, obviously, the other services that you're competing for in these crises really do matter, like water and health and education and that kind of thing. I think that broadly, this isn't really the ILO, this is my opinion, that humanitarian actors for CBA assume that markets are functioning in order for that CBA to be effective. And then there must be something similar for social protection. So like in recommendation 202, income security or social protection is seen as a modality to then access services, care, nutrition, these kind of things. I think there can be arguments around how to prioritize, again, in the humanitarian side, that there's evidence, even in Palestine at the moment, from UNICEF, I think, and the Cash Working Group, that people would prefer to receive cash, even with this situation throughout the crisis, and its markets have more or less functioned, but people have always preferred to have cash. But to say as well that I think to step away from some of this kind of messy competing for aid, which is decreasing. Again, this being able to transition to contributory social protection for as much of the population as possible, that kind of pathway avoids those issues in the longer term, because you end up with workers and employers that are contributing to then have this kind of social insurance mechanism. And I think we need to see in Protracted Crises how that works for informal workers or for forcibly displaced populations, how to include them into the social security systems. And so ILO is working on that in various places and hopefully can do more work on that. But looking at ways aside from just the aid that will never endingly be fought over as it decreases in amount.
Okay,
thanks.
Kate, I'm going to cut you off because looks like we can get Reid on screen. So ask a question on screen, Reid. So the floor's all yours.
Thanks so much, Paul, and thank you all for this wonderful, highly informative panel. I'm speaking to you from Jordan. I'm a PhD student at Bath, but I also work on gendered social protection in the Arab world, with specifically on Arab women, working mothers, basically, and their children, and how to strengthen the childcare economy, ecosystem. My question is, where do you see the role of community-based organizations who help deliver the last mile sort of services, stretch the very limited resources, and in general, strengthen this sort of service and delivery ecosystem? I don't see them spotlighted enough. Organizations like Sadaqa, who work on creating FEMA-friendly workspaces for working mothers and focus on, delivery of daycares, delivery of cash assistance, etc., etc. So where do you see their role in all of this? Thank you.
Thank you, Reid. I'm going to link it with a point in the chat being made by Abshir, picking up on the earlier discussion of zakat we were hearing, and I think a general point here is, I guess, is a tendency when thinking about social protection in crises to focus on A, payments, and B, sort of formal payment systems that are aid financed or national systems. And of course, they're one part of the picture, but there's a much more complex picture that includes the CAT, that includes the roles of community-based organisation, that includes sort of all sorts of mutual aid and sort of volunteer and community-led efforts. And a broader understanding of those sort of complex ecosystems and how they relate to each other, I think, is important as we start to think about what can be supported and how. And that's certainly something we're keen to explore in BASIC. We are a bit of a recent paper on mutual aid in Sudan. There's a brilliant paper on the scope of zakat in Pakistan by the International Centre on Tax and Development. So these things all interlock in interesting ways. And also, I think hot off the press today is Vincent van Halsema at WFP has been leading on setting up a discussion page on sp.org around informal social protection that's exploring some of these issues. And obviously, informal itself is a problematic term. Zakat can be very formal, and it can be more or less formal, more or less linked to states. But certainly understanding it better and understanding better how international financing support relates to these different parts of the ecosystem and to contributory systems is really important. So I've abused my role as the chair. Does anyone else want to come in on the response to Reid, to Abshir, or to what I was just saying?
I can just quickly come in to say that in an ideal world, what we would love to be able to do is to track the financing right the way through from these sort of big transactions from, say, the World Bank to a government or an implementing partner, and look at who else, which other organisations does that flow to. Now, unfortunately, that's not possible at the moment, but I think that's something we should continue to push for. And also, obviously, given that there's such a minuscule amount of financing that goes directly from international donors to those local actors, obviously more on the humanitarian side than on the social protection side, but I think more visibility of that will really help us. Yeah, I think when it comes to conversations around zakat, around other forms of mutual aid, I think there's two things to look at here. One is obviously understanding and getting that much bigger understanding, and great to see all the work that's going on around that, of what exactly is there, what's going on, but not necessarily with a view to leverage it for national systems or leverage it through international channels, but to complement it. It'd be really interesting to see where this stream of work goes.
Great. On that note, I think we're going to have to wrap up because we're coming to the end of our hour. Sophia and Kirsty are going to be doing more work on financing for social protection in protracted crises over the next 6 months or so. We're going to have the opportunity to sort of dig into a bit of some of what we're talking about today, in particular to sort of focus on on some particular country context and try and do more of the slightly more granular analysis that Sophia was just talking about. As we were hearing from Wesam and others, there is the ongoing high-level panel on social protection in conflicts that is at an evidence gathering phase. So if people have views, do submit evidence. If people want to sort of track the process, do check out the new website that went up today. If people are interested in the sort of intersections with more and less formal types of social protection and social assistance, do check out the hot off the press sp.org page that Vincent has nobly set up. Coming later this year will be a World Bank approach paper that sets out its approach to supporting social protection in situations of fragility and conflict. All of which to say, I think, is that this is a really exciting moment. Yes, it's an enormously challenging one with the degree of aid cuts, and we need to be careful not to sort of let donors off the hook and to keep making the case for them to support social protection in situations where domestic governments are struggling to do that. But we are, I think, demonstrating that there's a possibility and the potential of supporting social protection in protracted crises. People like Wesam and Fardosa are doing an amazing job of establishing national systems, even through situations of crisis. And so more support to enable to do them better is really important. And there's a really exciting policy moment to drive that forward. So thank you all for making the time to think about it today. Do read the paper that's in the chat, do have a look at the other resources, and do follow up with us if you have any questions that we didn't get a chance to get to, and do stay in touch as with us, with the high-level panel, with the informal social protection community on sp.org as we take these issues forward. Thank you very much, everyone. And thanks to Sophia and colleagues for a brilliant paper. Do read it, everyone. Thanks to Tabs for the support on the communications and getting us up and running. And thank you very much, everyone who's participated. Though they're leaving fast, I can see the participants diving. Bye, everyone.